Hello dear patients, today we are going to review the case of dermatitis in groin. A man came to us with constant redness in inguinal fold, with constant erosions and itch. He is an allergic and he knows about it, but it doesn't help his condition in any way. For this patient, analyses for herpes were taken, as there were erosions that were quite suspicious for herpes. Culture test from the surface of rashes was taken, and also skin scraping for fungus was taken. However, all these analyses were more or less within normal. Staphylococci were slightly increased there. However, this is not something critical for inguinal folds. The patient had increased level of immunoglobulin E, and as I already said, he was an allergic. So, what's the problem here? The problem is that in the area of friction in inguinal fold, where there is often an increased number of bacteria, an inflammation is developed on a mixed and allergic bacterial nature. Unfortunately, hormonal creams do not always help here, because they cannot deal with internal cause of allergy. So first of all, this patient was referred to allergologist consultation. Immune status, analysis for parasites and many other analyses were prescribed. You can watch a separate video about analysis for allergy. Also, circulating immune complexes, etc. were prescribed. We are not going to cover it now. A correction by allergologist was done. We prescribed sodium thiosulfate intravenously, calcium gluconate intramuscularly, antihistamine medications, sorbents for intestines. In such cases, externally, apart from hormonal and anti-inflammatory ointments, it's important to use some disinfectant stuff, like compresses with furosemide. First of all, it cools and reduces the inflammation, and secondly, it reduces the number of bacteria. This has to be done on a regular basis. You cannot just do it today but not tomorrow. Here there should be a fight with different allergens, allergic desensibilization, and the use of compresses, antihistamine medications, sorbents for intestines, keeping a diet, etc. All of this was prescribed for this patient. He didn't get rid of allergy completely, it remained in the body. However, these skin rashes resolved almost completely. These rashes bothered him for many months, so he was quite satisfied with it at the present moment. So, in groin, in the areas of friction, in the area of folds, where there is an increased number of bacteria, dermatitis often develop, particularly allergic dermatitis or bacterial dermatitis in people who have predominance to it, like allergics. Even in usual people, the trigger is basically a dermatitis. So, inguinal folds are an area where dermatitis frequently develops. So, even for usual people, it's necessary to follow the rules of usual hygiene, to use powders, at least in the beginning of disease, which reduces friction of these areas, and to use different anti-inflammatory creams to reduce redness, etc. If such simple measures do not help, then it's necessary to consult dermatologists for detailed examination of this problem. If there is any redness in the area of groin, you can consult dermatologists of our paid medical center of Dermatit Neurologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.